Okay. The next speaker is Rosalia Rinaldi, and introduce different training program approach for parent and teacher of pupil with ADHD. Thank you.
Good morning. I'm Rosalia Rinaldi. I'm a psychologist. I have been working for CedAp for 7 years. I present today training program for parents and the teachers of pupils with ADHD. Okay. As Chiara said before, ADHD is the acronym for Attention Deficit Hyperactivity Disorder, and is one of the most common child and adolescent neuropsychic growth disorder, characterized by lack of attention, hyperactivity, and impulsive behavior. ADHD predominance is 4–5% in Italy, 2% mixed in Europe. So in this table, we can see the prevalence rates of ADHD in several different European countries. Italy is, where is Italy? Here. So the prevalence is 3.9. It could be said that on average, in a class of 25 pupils, there is one with ADHD. Yet very often, the problem is completely ignored. Diagnosis is made late, and help comes later at an even later stage, or is inadequate or uncoordinated. It is therefore essential that the awareness of mental health professionals, psychologists, doctors, and teachers regarding this disorder and its treatment is as up-to-date as possible. ADHD, a possible growing disorder, which the age, so we can see that destructive behavior and difficult relations with adults or peers, then low self-esteem, poor social aptitude, struggling with learning. Then, with the growth, oppositional defiant disorder, mood disorder, and provocative behavior. At last, we can see antisocial behavior, expelled from school, drug abuse, conduct disorder, and learning difficulties. So it's very important that a child with ADHD can have early diagnosis. So it's important of prevention of secondary disorders, low self-esteem and academic difficulties, antisocial behavior, and right to treatment. Every treatment has to be adapted to the personal characteristics of the subject, to his secondary disorders, cognitive resources, social and familiar condition. Several studies demonstrate that the optimal approach to tackling it is the multimodal treatment of ADHD. Multimodal treatment are for family with parent training, child with pharmacological treatment and behavioral therapy, and then school with teacher training. Pharmacological treatment, the multimodal approach that combines psychosocial interventions with medical treatment is the most recommended one. In Italy, the approved drugs for treatment of ADHD in children from 8 years on, and in adolescents as a part of a multimodal treatment program are Strattera, atomoxetine, and Ritalin, methylphenidate. Behavioral therapy is based on cognitive and metacognitive techniques aimed at reducing impulsiveness, controlling attention, and organizing personal activities. Cognitive behavioral intervention can either be carried out individually or in a group. For example, for social skills. It combines the teaching of cognitive strategies, for example, the stages on problem solving and self-monitoring, with behavioral change methods, such as reinforcement, self-reinforcement, and modeling. In the case of comorbidity, anxiety, learning disorders, oppositional defiant disorders, etc., it is essential to integrate ADHD treatment with specific training aimed at reducing symptoms. Parent trainings means helping parents correctly interpret their child's behavior and adopting a positive approach. Creating an environment that encourages self-regulation and reflexivity. Teaching parents certain educational techniques. Increasing their strategy skills. But doesn't mean making parents co-therapists. Parent training programs are psychosocial interventions aimed at training parents in behavioral or cognitive behavioral techniques they can use to manage their children's challenging behavior. The programs vary in their style and content, but are generally manual-based and may involve discussion and the use of video and role-play. Teacher training. Systemic counseling to teachers is another key element. ADHD children at school display problematic behavior which is difficult to control and handle. Poor teacher training in this area means teachers cannot deal properly with the learning and behavior of the ADHD pupils and cannot reduce school dropout rates. The ADHD, together with the frequent comorbidity with conduct and sex disorders and learning disabilities, make students more likely to be suspended and expelled, and to have a high probability of dropout. Well, so it is essential for parents and teachers to play an active role in understanding the meaning and the purpose of certain behavior in order to plan genuinely effective treatment. Functional assessment, an approach focused on the solution to the problem and the specific condition, is essential. A well-structured assessment is needed to achieve effective treatment. General assumptions are: problem behavior has a specific action. It has one aim. It aims to communicate. It doesn't happen by chance, but may aim to control the surroundings. It is also linked to events coming before and after it. It can have multiple functions. A therapist wishing to select more positive, effective methods of therapy must obtain information regarding the aim and the function of problem behavior. They may start by observing the problem behavior, at first casually, then systematically, in order to operationalize it in terms of regularity and meaning. This operation is known as functional behavioral analysis. The information generated from the analysis functional facilitate the formulation of hypotheses about the function of problem behavior. Why they start to show that kind of behavior? What will you get? What are the setting events that influence the manifestation of that behavior? The behavior occurs with the intention of attracting attention as a means to achieve a tangible item, object, or permit for an activity, to avoid or escape from a task, activity, or individual with particular, as a means to sensory feedback, to communicate a state of discomfort or pain. There are different collection strategies on which to base their hypothesis. For example, structured interviews to teacher, or systematic observations with diagrams, analysis ABC, observation of communicative intent, and functional analysis of experimental and systematic, if we uncertain. So, this is a typical systematic observation example. We have antecedent, behavior, consequent, and child's reaction. All this aims to work in advance, acting on the antecedent, to reduce the possibility of problem behavior arising. A typical behavior adjustment program is based on the sequence of 3 components. A, antecedent event, B, behavior, C, consequent event. There is no such thing as a behavioral void. Treatment which tends to change or favor certain behavior is based on the principles of operant conditioning, according to which it is possible to reduce negative behavior and encourage positive functional behavior with the use of recompenses, reinforcement, and punishment. More recently, investigations have demonstrated the efficacy of interventions that involve altering antecedent events in an attempt to prevent ADHD-related behaviors from occurring. For example, strategies such as increasing task stimulation, implementing peer tutoring, and providing desk choice have been associated with increases in attention along with concomitant reducings in disruptive classroom behavior. Teachers and parents, however, do not make use of functional analysis on a daily basis due to a lack of training and because it is seen as a long and tiring procedure, partially due to the fact that it is done manually, with paper, graph, and pencil, and there is no time in a classroom. On the basis of these considerations, the ONE project aims to experiment a web application accessible via PC and mobile devices to quickly and easily monitor the behavior of pupils in specific contexts. With the use of the data collected during monitoring and via the application of the web, health professionals, parents, and teachers will together be able to draw up the best treatment plan for the pupils and learn the most suitable strategies for handling ADHD learning and behavioral difficulties. This way, it will be possible for those dealing with the child affected by ADHD to work in synergy and easily put into practice the sense of what we refer to as multimodal treatment. Okay. Thank you very much for your attention.
Thank you, Rosalia, for your presentation. There are questions about this argument. Questions? Sì.
Volevo chiedere soltanto se dopo queste presentazioni all'atto pratico ci saranno dei corsi di formazione per gli insegnanti.
Okay. The question is if there is an educational program for the teacher during the development of the project.
Yes, because today is the startup of one project that that draw this course for teachers. So teachers and parents, because we will work to a web application and we wish to achieve a product that they are very useful to the teacher and the parents.
Yes, it is. There is a specific phase of the projects that is targeted for the teacher and parents training. So it is included in a specific phase of the project. So the answer is yes. Okay. Okay, we have a coffee break now, and we can restart the sessions at 11:30. The coffee break is outside of this room on your right. Thank you.
Is this? Please, put here.
Is that the pen?